It's taken families decades to get to this. Do you agree with Baroness Cumberledge that this is a scandal?
Yes, I want to issue, on behalf of the NHS and the whole healthcare system, I want to issue a full apology to those who've suffered and their families for the frustration, for the time that they've taken to get their voices heard, and now their voices have been heard. It's very important that we learn from this report that we commissioned to make sure that these sorts of mistakes don't happen again. We're going to look very carefully at all of the recommendations, some of which are already being implemented, and all of those recommendations we're going to study very carefully. I think that the seriousness of the report, the horrific nature of many of the things described in it, that deserves very careful consideration of these recommendations. Some will get going on immediately, and others will consider. And I've met women who've been badly affected, especially those who've been badly affected by mesh. I've seen the pain and the suffering that these three problems have caused, and I'm very glad that we've got this report with very significant recommendations. Well, I think that the need for the system to respond quickly to concerns like this is incredibly important, and we need to have a regulatory system that responds to that sort of concern, and that's deeply embedded in all of the recommendations. I think that this report is a wake-up call to the system to respond to patients' concerns and take very seriously concerns from people who are suffering. One of the most striking things I found from talking to some of the women who'd been badly affected is that not only were they suffering in pain, but also the deep frustration that nobody in authority in the system would listen to them. And we have listened, and this report details those painful accounts. That voice has been heard now, and we need to take action, and that's why we're taking forward some of the recommendations immediately, and we will consider all of the recommendations in full.